I've worked to develop techniques that are surrounding minimally invasive implant technology that I guess is worth doctors to travel to Salina and learn. Most of the patients that come to me personally, are getting to the point where quite often they, on some level or another, are becoming crippled dentally. So when I mentioned earlier, whether it's missing teeth, whether it's loose dentures, painful teeth that are broken, or a broken down bite, they've oftentimes lost their ability to chew and function. They've lost their confidence in their smile. There's a multitude of things that impact them, and it ends up being personal impacts. It ends up being professional impacts at times. So it's a lot of those different things that really has happened, and sometimes it's a slow, gradual process that they almost didn't see coming, and then all of a sudden they realize, gosh, I'm sort of painted into a corner here, and then other times, it's a more dramatic event. Something just broke, and they need a solution. We've had people come to Salina to learn dental implant, minimally invasive technology and techniques from me, and it's just extremely humbling to know that I can have that impact through things that I've seen as just really I developed because I felt like it was a better way to serve patients. I had a wonderful lady in just the other day, and we were talking after she had finished a lot of her treatments, and we were reflecting back on where we started. And when she had come to me, she had been this wonderful woman, raising children, going in, serving in public office, very active in her community, and as her dental condition deteriorated, she got to this point of feeling like she didn't want to leave the house anymore. She was she had given up her service projects that she was doing. She was not going out in the community, even for things with her friends, her closest friends. And then, this dreaded fear of even having her spouse see her without her teeth and things like that. And so, yeah, and where she ended up with some gaps and some discolorations and things, and just knowing that she was in a bad place. And so we looked back after we had finished this, and she's like, "Oh my goodness, I'm back." That was really what she said. "I'm back. I'm ready. I'm doing stuff again that I used to do that brought me lots of joy." And that's just one example of somebody like that. It's not always physical pain. It's oftentimes the emotional pain that gets to people more.